Does shockwave therapy work for erectile dysfunction? Listen to these testimonials.
So I want to read a review from one of our patients here. So we sent him a message. Did you see any improvement since you did the ED shockwave treatment? He said, yes, I did, and I may take a few more treatments soon. He also asked, did you get the testosterone shot yet? To give a little history of this patient, this is about 65 to 70-year-old guy, retired a little while, had some ED issues for the past 4 or 5 years. Fairly active, used to be a runner, used to be fit when he was younger. Started to have this problem a few years now, so hard and came for treatment. As we went along the treatment, we gave him some advice in terms of diet, exercise. He used to continue doing some weight training once a week. They increased his diet a bit, increased his exercise and weight training for maybe 2 to 3 times a week, right? And with this now, we saw a lot of improvements while he was doing treatment. So he continued to progress through the 6 weeks of treatment. Now, 6 weeks is really a kind of short time to see improvement. So we continue to follow up with him with messages and whatnot. And about 3 months after this, we messaged back and replied that he did see treatment. Now, as you may have mentioned, he asked about testosterone. Knowing he's a 65-year-old plus guy, testosterone tends to decrease in that age group. And that could be one of the causes of causing ED as well. So we were looking to treat his ED with probably the testosterone as well. So in these older patients, we may have to do shockwave, but there may be room to maybe improve as well using other forms like testosterone, replacement therapy, or even other medication. So each patient is unique, but this is one episode where he did get some improvements with the treatment, and we also look at maybe improving by doing some other things in terms of the testosterone, hormone therapy, and possibly medication. Okay, so now we're going to go through one of our reviews from a patient that we sent a message to find out how was the improvement with ED. So we sent him a message, did you see any improvements since you did your ED shockwave therapy treatment? He said, oh yes, I did. I also combined the success with exercise, change of diet, and proper rest. So this is about a 55-year-old guy who owns his own business. He has a lot of stress, right? And he has noticed ED issues for the past 2 or 3 years. He has mild to moderate ED, and he sought to come for shockwave treatment. So we did the course of therapy for 6 weeks. Again, we always try to incorporate diet, exercise, giving specific things of what to do in each, and medication, I think, with our therapy. So during that 6 weeks, he was able to make some changes, improve his diet, also started an exercise regime, and he did see a lot of improvements within that 6-week period. So this just shows to tell you that sometimes treatment alone may not be the only avenue that we take. We have to look at it in a comprehensive view, looking at diet, exercise, treatment, possibly testosterone in the older age groups, and maybe medications as well. Okay, so this is we're going to go through another review of one of the patients follow-up that we had. So we sent him a message, did you see any improvements since you did the ED shockwave session? And he said, good afternoon, yes I have, thanks for the follow-up. We're going to talk a little bit about this patient. He was probably, again, between 50 to 60 years old, a bit overweight, having problems for about maybe 3-4 years now, right? So he came to us, we did shockwave therapy. Again, we advised him on diet and exercise. However, he was a bit overweight, was a bit difficult to get him to do exercise. So he wasn't able to do a lot of diet or exercise changes during treatment, but he still saw some results. Although he had results, we did have to supplement with some medications to continue the improvement after his therapy. So we continued to follow him up maybe in every 2 to 3 months intervals, and at that point we adjust medication to see how we do. So it goes to show us that after that 6 week with us doing shockwave therapy, we have to ensure that we follow up these patients, because although we may see a little results, we can improve that by combining diet changes or exercise if that's not possible, hormone therapy or medications. So it just shows the importance of follow. Okay, so we're going to go through another review of one of our patients that we sent follow-up for ED treatment. So we sent him a message, did you see any improvement since you did your ED shock? And he stated a little improvement. Now, to give you an idea, this is a good example of a patient in terms of where shockwave may not be appropriate or may not give proper results. So this was a 70-year-old guy who started to have a decrease for the last 5 to 10 years. He had between moderate to severe EDs. However, he still wanted to do treatment. A lot of patients in the older age group do come and basically they ask us, doc, well, what do I have to do? So after, speaking to him, consulting him, telling him that we're not sure how well this treatment will work, seeing that he was in the moderate to severe group, and because of his age, he still decided to do treatment. After his treatment and follow-up, he did get a little improvement, but that little improvement was with the Shockwave alone. However, if he uses medications and tablets, he's now getting a lot better improvement than before. So before, in terms of when he take medications, he wasn't getting any result and his ED was getting worse with time. Now, although it didn't improve that much with Shockwave, when he takes a tablet, he's able to have better results. So it goes to show that although in the older age group, there is a bit more risk that the results may not be as good. When we do the consultation and explain the risks and the advantages that could happen, it's a decision that patients make in terms of whether they want the Shockwave or not. So we're going to go through one of the results again in terms of one of the messages we received in terms of ED treatment. So we sent a follow-up message to the patient in terms of, did you see any improvements with the ED Shockwave treatment? And he said, yes, I did. Now, to give you a background of this patient, this was about a 55-year-old guy who was, semi-retired, and he had mild EDs. However, after treatment, he came to us, he did the treatment. After the 6 weeks, he started to see some results, and about a month after that, he was able to see a lot more results. Now, he was very happy with his treatment. So in terms of him, he was able to combine diet, exercise, and the Shockwave therapy to get better results. So it goes to show that in the younger age group, those less than 60, and also with those with mild ED issues, that Shockwave remains a very good therapy to help in terms of long-term improvement of symptoms. Okay, so we're going to go through another results of one of our ED patients. Now, this is a good example in terms of where Shockwave may not be appropriate. So we sent this to the patient in terms of, if he see any improvements with ED Shockwave treatment. Now, he said, I believe there's improvement. I am diabetic, so it is minimal. So as from our experience and as from the data out there, and for diabetics, the results tend to be less and the improvements also tend to be less. So this was about maybe a 60 to 65-year-old guy, known diabetic. His A1C was maybe around 8 or 8.5. He was on medication. He still decided to do treatment and he saw some results, but the results were not as good as he would have liked. Now, in our case, we would prefer that patients with chronic conditions such as diabetes or hypertension have this very well controlled for at least 3 months, and then we could consider treatment. So a lot of these patients, we discussed with the patients in terms of having that diabetes, high blood pressure, and other medical conditions controlled first, and then we can consider treatment. Some patients would like to do treatment right away. However, we have to advise is that the risk is that we may not see as great improvement as if we wait. So dealing with ED is not a short-term process. It's a longer-term process in terms of where we have to combine control of your current medical conditions, the use of Shockwave, follow up with diet and exercise, and also hormonal or medical therapy afterwards to continue. So we use all these forms to try to get the best results for the patients.
To book a consultation for erectile dysfunction, call 747-5297 or 308-3370. You can also WhatsApp us, and we are located at number 4 Chincuna Gardens, Chin Chin Road in Cunupia.
You can tap the description below for all of our contact information.